Today we are here, as has been mentioned by our donors and our development partners who have been of great assistance to the people of Fiji, to this particular ministry over the years and during this year in this area and in other areas, and we're very thankful for them. But they've explained that with this donation, the donation of the Proto-Test and Proto-Lab kits, the utilization of the portable kits to test drinking water quality in rural communities will further enhance and strengthen the ministry's role in monitoring drinking water quality as stated in the Water Promulgation Decree of 2009 and in the Fijian National Drinking Water Quality Standards. I would like to thank the World Health Organization and UNICEF for their collaboration and partnership and working together with our Environmental Health Unit in the procurement of 13 Proto-Test and 4 Proto-Lab kits. These kits will greatly assist our environmental health officers tasked by the ministry to monitor rural drinking water quality in Fiji, because rural drinking water quality is a major issue in this country, as I've come to realize in the 2 years that I've been here. Water is such a basic necessity for life. It's a basic necessity for making sure that our people can live well and stay well. And when they don't have that water, it has a problem, it has an impact on their ability to live well and to stay well and let alone get well. In Fiji, according to the data that I've been given, approximately 53% of rural populations drink water drawn from creeks and rivers. Pit latrines tend to be shallow, often flooding into nearby waterways and high water tables. Additionally, Fiji is very susceptible to tropical cyclones and flooding, and this initiative will allow our people to be able to monitor the quality of their water and to allow them to take immediate responsive action by the ministry to limit the transmission of waterborne diseases and the loss of lives. This initiative, this development, is in line with one of the areas of our strategic plan, Area 3, which talks about communicable disease, environmental health, and health emergency preparedness, response, and resilience. And we have objectives that are looking at the coverage and effectiveness of environmental health and risk reduction interventions for communicable diseases. Related to that is another objective, to enhance national emergency and disaster preparedness, management, and resilience. This initiative by the World Health Organization and UNICEF is also, as has been mentioned to them, is their response to the provision of quality drinking water in the aftermath of Tropical Cyclone in all of those areas that were affected by Tropical Cyclone Winston. I have been informed that most of the kits will be distributed to all of those areas that were affected by Tropical Cyclone Winston: North Tailevu, Rakiraki, Korobo, Wanombalavu, Lomaiviti, and Tavuini. I would like to commend all the stakeholders on strengthening collaboration between the Ministry, the Water Authority of Fiji, WHO, and UNICEF in improving the monitoring of drinking water quality for every Fijian. In the final analysis, our main target is to be able to have a presentation made to Cabinet and to Parliament that describes the status of national drinking water quality in Fiji and our attempts to improve that, because this is also a right that we have given to our people in our Constitution, and we will forever be moving towards trying to make sure that people have the right quality of water that will allow them to have the best possible life in our country. In conclusion, I would like once again to thank WHO and UNICEF for this initiative, and would like to thank all the partners involved, our Department of Environmental Health, DIP and your team, and who are currently working with WHO and UNICEF in coordinating all the water testing activities. And in addition, just in closing, I'm very glad to see that we're having a greater emphasis on these projects in which we take these things to where they are needed. I know in the past we were always about collecting samples and bringing them to the center, then analyzing and doing the results. I think a few weeks ago I was at Mataika House, where we had the donation of the, what do you call those things? The microscopes that allows people to identify the mosquitoes out in the areas, identify them quickly and take quick action. And that, I think, is something that has to be, that is something that we'll need to continue to concentrate in this ministry. Take the service and the analysis out to where it is needed as quickly as possible, so the problems can be analyzed, it can be identified, and it does not go through this bureaucratic wrangle of things being transporting along, taking 2 or 3 months, then finally it's decided, and then takes another 2 or 3 months to be able to implement. Because I think our mantra now, we need to identify what the problems are, analyze them quickly, come up with the solutions, and deliver it so that we can continue to work towards our vision of a healthy population in this country. Water is such an essential element. It's such a basic thing, such a basic right that people need to have. And our role, of course, is not to supply that water. Our role in this ministry is to be able to test it, to make sure that it is safe, and to provide the advice to those organizations that are responsible for providing the water. So I thank you, ladies. Please convey my appreciation to your organizations for their assistance, and we look forward to a continued partnership. And through this partnership, we will save the lives of many children and will help them to improve their lives. Thank you very much, and God bless us all.
Thank you very much, Honorable Minister. We will now also